Hi everyone, I'm Abner. This is going to be my senior lecture. So I've been thinking about what my senior lecture will be about for the past couple of months, and I thought I could talk about life hacks that I discovered on how to develop a healthy lifestyle with the limited time we have during residency. I thought about doing a lecture dedicated to home, to Puerto Rico. I thought about doing a lecture about traveling and exploring. And of course, I thought about doing a lecture on wilderness medicine. And yes, this lecture will have a lot of wilderness medicine and global health. Unfortunately, I will not talk about the exciting and fun aspects of it. And the reason is for the past couple of years, I've been trying to understand better how the world works. And I think that's unfortunately driven by all the conflict and war happening in the world. And I constantly reflect about several things. Number one, we are incredibly privileged. And I know our job is hard, it's stressful, but we sometimes forget to look back and realize we are living the dream we had 5, 10, 15 years ago. We have a place to live. We don't really experience food insecurities other than sometimes not being able to eat during our shift. We are incredibly educated. And now, even though it's a little bit hard to think about it this way, we do make a decent amount of money compared to other people in the world and even other people in the US. And we know it's only a matter of time until our salary dramatically increases, which is not true for many people. By the way, this is not an excuse. There's always stuff to improve. And I think we're all in debt with Shane for helping us have a competitive salary. But what I'm trying to say here is in the big picture, we are privileged. Number two, defining what is right or wrong is sometimes obvious, but often that's not the case. And number three, the world is incredibly connected and interdependent, but at the same time, it feels disconnected. And that's true in terms of economy, politics, social media, but also physically and in space. These are the longest roads in the world. The longest one is the Pan American Highway, and it was built in the 20th century with the goal of connecting America, facilitating trade, strengthening international relationships, creating new markets, and developing the economy, but also with military purposes. Essentially, the Pan American Highway is a quick way to access the Panama Canal in the event of war. But there is something interesting about the Pan American Highway. It doesn't really connect North and South America. There's a stretch of approximately 60 miles where there are no roads. Anyone know what this region is called? Darien Gap, correct? So this is the Darien Gap. It sits in between Panama and Colombia, and not only the Pan American Highway doesn't go through it, but there are no roads, no infrastructure, no cell phone service, and practically no government or civilization. So what's in there? Well, the Darien Gap, it's a beautiful rainforest. It's home to a few indigenous tribes like the Wonan tribe and in Puerto Lara, and amazing biodiversity. In fact, 1 in 5 species in the world are endemic to this region. For centuries, this region has been considered an impenetrable jungle and has a reputation of being inhospitable. The Spaniards weren't able to fully conquer it in the conquest era. And several countries have tried to conquer it and build stuff in there, but they haven't been successful. In 1870, the US tried for a second time. They did an expedition with about 100 men and modern equipment for the time, including a telegraph, but they failed. And the reason this region is so precious, not only is for the ability to connect North and South America, but also the fact that the Darien Gap is at sea level. So there's a theoretical idea of connecting the Pacific Ocean and the Caribbean and building a canal. So let me explain this. We do have the Panama Canal, but the way it works is you can imagine there's a mini mountain in between the east and west coast of the Panama Canal, and on top of it sits the Garum Lake, which is an artificial lake. It's about 26 meters above sea. And the Panama Canal uses this man-created system of locks to raise and lower the ships. It's very complicated. It's very expensive. It uses a lot of water. So having the idea of having kind of like a sea level canal, it's ideal for making everything easier. Having said that, now we know that's not a real possibility necessarily. In 1964, the administration of President Johnson proposed using 325 nuclear explosions to blast the territory. They published a New York Times article suggesting that the nuclear fallout would be safe, given the deep jungle was only sparsely populated. Of course, that didn't happen, thank God. Since then, there have been discussions about creating infrastructures and roads in the region, but it will cost a lot of money and it will be at the expense of threatening biodiversity in the region. Also, there's a lot of political discussion. Despite the Dorian Gap being a beautiful place, unfortunately, nobody really goes there to have a nice time. Since about 2010, the Dorian Gap has been used by asylum seekers and migrants as a route with the goal of entering Mexico, the US, and Canada. However, before 2021, the number of people crossing the jungle was pretty low. In 2021, more than 100,000 migrants and asylum seekers crossed the jungle on foot. In 2022, it jumped to almost 250,000 people. And in 2023, almost 500,000 people crossed. Most of the migrants and asylum seekers are from Haiti, Venezuela, and Ecuador. But there's also people from China, India, Afghanistan, and Colombia who use the route. The journey takes about 12 days and it's extremely dangerous. These people travel without appropriate hiking gear. They travel with kids and elderly people. They need to travel light to move quickly so they don't carry enough food or water. On top of that, there are several environmental challenges. Drowning is the most common cause of death. People are required to go through several rivers, and some of those rivers have extremely strong currents. And in general, not only here, but in every river, the most common reason people drown is not knowing how to swim. Having said that, even avid swimmers cannot fight the strong current of a river. On top of that, when people hit cold water, their muscles spasms and their breathing becomes irregular. Crossing the river is particularly challenging for kids because they are shorter and they can get completely covered easier. And this is how the river looks in periods of heavy rain. Traveling with wet shoes can also make people more propense to developing blisters, which are extremely painful. And I don't know if you guys were ever told that it's safe to drink water from the river if the water is running, but I was always taught that as a kid, and that is completely false. And the issue is that there's a lot of people who still believe that. And I saw a video where, in preparation to depart into the Dorian Gap, the guides who coordinated the trip gave the migrants some pills, and I'm assuming they were iron pills for water purification. And the migrants said, I didn't even think about water purification at all before doing the journey. The issue about drinking water from the river is that we never know what's upstream. And it can be animal or human feces, or it can be the dead animals, or in this case, dead humans. E. coli, Shigella, Salmonella, Vibrio are some of the most common bacteria, but people can also get infected with viruses and protozoa. People with severe infections can easily die of dehydration because of GI illnesses. And as a quick review, the most effective way of water purification is boiling, which is the basis of pasteurization. But other methods, such as filtration, can be effective, especially if you combine them with halogenation, such as with using iron pills. Even if they have clean water, they can still die of dehydration just because of the weather. It's highly humid and the temperatures can reach up to 95 degrees Fahrenheit. So people are at a high risk of heat exhaustion. Injuries are very common and there's no way to do any sort of evacuation. People often need to leave their loved ones behind. There are venomous snakes, and this is the Central American bushmaster, which is a venomous pit viper. It ejects a deadly neurotoxin and a hemotoxin, and it can cause hypotension and hemorrhagic shock. Of course, there's no antivenom in the Darien Gap. There are crocodiles, and of course, the Darien Gap is home to the deadliest animal in the world, mosquito. So these people are at very high risk of getting infected with dengue, malaria, yellow fever, among others. If that wasn't enough, in the 20th century brought guerrillas, drug traffickers, paramilitaries to the Darien Gap, who used the dense forest to hide. Guerrillas such as El Clan del Golfo in Colombia, they tax the guides, or coyotes, how they call them. So they tax them, kind of like to take advantage of them. On top of that, they take advantage of the migrants by robbing them, raping them, and capturing them for purposes of human trafficking. Some of the coyotes and guides even hand them directly to the guerrillas. People that survive make it to a small village with limited food and water and medication. This village, for example, is called Bajo Chiquito. And in this village, sometimes they have medical and humanitarian organizations such as Doctors Without Borders. And they provide medical treatment, among other services. The majority of people are treated for skin infections, body aches, diarrhea, respiratory infections, and GI issues. And the most common chronic diseases that they treat are hypertension, asthma, diabetes, and HIV. They also provide mental health resources to victims of violence, rape, anxiety related to family separation, and harsh living conditions. In regards to sexual violence, notice that most people are outside of the window to receive post-exposure prophylaxis, which is 72 hours for HIV, gonorrhea, chlamydia, and syphilis. Unfortunately, in March 2024, Doctors Without Borders was forced by the Panama government to suspend all medical activity in Panama. So why did I spend so much time talking about the Darien Gap, and what does it have to do with us? Well, one of the reasons I chose to train in this program is because of the cultural competency each and every one of you have. I think you guys are all caring, compassionate, and you guys are physicians who treat people regardless of where they come from. And I truly admire that. However, when we live, we might work in places where people might not understand the circumstances of asylum seekers, migrants, and refugees. And even at our institution, I've heard once or twice people asking, why did this person move here? They don't even speak English. And the answer to that question is they didn't really have a choice. I just talked about how people are willing to risk their lives, go through the Darien Gap because they are desperate. Some of them feel like they will just die at home, and if they don't attempt this. Venezuela has been experiencing a humanitarian crisis for several years, and even though they have the biggest oil reserve in the world, to punish Maduro's unrecognized re-election, several countries, including the government of the US, UK, Canada, have sanctioned Venezuela's economies, particularly the oil industry, which is 95% of the Venezuela's economy. This led to accelerated money printing, which led to severe inflation in Venezuela, which led to the humanitarian crisis we all know. People essentially stopped being able to afford food, and hunger and malnutrition flooded the country. This, of course, also led to violence and protest. In January 12, 2010, a magnitude 7.0 earthquake struck the already poorest country in the West Hemisphere, and Haiti hasn't fully recovered yet. Since then, they have also suffered a cholera outbreak, several hurricanes, a fuel crisis, and another earthquake in 2021. Currently, gang violence controlled like 80 to 85% of Port-au-Prince, including access to food, water, and medical supplies. So people in Haiti currently live what it feels like a never-ending civil war. If that wasn't enough, Haiti's main economic sector is agriculture. However, the land is not fertile. Historically, there has been massive deforestation because carbon is still their main source of energy. So deforestation leads to drought, which it also leads to soil erosion, which leads to suboptimal conditions for agricultural activity. The politics in Haiti have been historically unstable due to several regime changes, internal conflicts, corruption. And since the assassination of President Jovenel Moise in 2021, there haven't been presidential elections. In Ecuador, several drug cartels, including Colombian, Mexicans, and Albanian organizations, fight for the control of cocaine exports. Currently, Ecuador exports like 70% of cocaine in the world, mainly to Europe and the US. In 2019, Ecuador used to be considered one of the safest countries in Latin America, but in 2023, the city of Duran in Ecuador was considered the most violent city in the world. Overall, this also led to an economic crisis. So let me share some stories of some patients I've seen for the past couple of years. Once I was working in the pit city, I had a 10-year-old with history of epilepsy who came to the ED for medication refill. She was on a medication that wasn't readily available in the US, and she was having a lot of trouble finding it. Eventually, she went home on Kepra. The mother told me she flew from Texas. She flew to Texas, and from Texas, she was sent to New York City for asylum seeking. Her husband was involved in politics and was killed by a group of guerrillas in Colombia. They were also threatening to kill her and the rest of her family. She says she didn't have a choice other than to leave the country. I had a 40-year-old construction worker who came to the ED for a laceration repair in his finger. I had a conversation with him, and he told me he was from Honduras, and living there, he didn't have food, and he couldn't support his family. He, at some point, was forced to come to the US, and he has been living here for the past 10 years. He works here, he sends money to his family, but he told me he cannot really leave to visit his family at any point because otherwise he cannot come back. He has a wife and a son in Honduras, but he told me his son didn't talk to him. He said his son was mad at him for not being close to him. And then he told me, kind of like almost crying, one day he will understand the sacrifices I'm doing. 50-year-old patient from Ecuador came to the ED with right flank pain. He had a kidney stone. He recently moved to the US from Ecuador. That was in 2023, and he said he owned a store. He was successful. However, due to the gang violence in 2023, they robbed all of his belongings, and he was left with nothing, only fear. So how can I help? To recent migrants, at least like the bare minimum, I always ask 3 questions. Do you have a place to stay? Do you have food? And do you have a primary care doctor? And if I'm taking care of a kid, I usually ask, is the kid going to school? If there's any concerns, we can always get our social workers. But there are also multiple resources here that New York State offers. And I want to thank Dr. Adrian Orcochea for telling me about these resources. In New York City, we have several refugee resettlement agencies, and you can use this QR code if you want to access the website. And by the way, in this lecture, I only talk about refugees and migrants who travel through the Bering Gap, just as an example. But remember, these issues are happening all over the world. We also receive asylum seekers from Afghanistan, who are currently under the regime of the Taliban. We receive asylum seekers from Congo, Syria, and many other places. So in this website, they have programs where they pair teenagers and young adults to adult mentors. They also have programs to help refugees attain economic self-sufficiency and give them access to case manager, offer them employment, training services, English classes, health and medical services. They also have services for students. They have services for confirmed victims of human trafficking, and they also have services for people over 60 years old. Canva is a nonprofit Brooklyn-based organization that offers an array of community-based programs, and among these programs, they have refugee assistance programs. They offer very similar service to the ones I mentioned in the prior slide. And they work with both asylum seekers and immigrants. But there's another benefit that is super close to us. There are other organizations for migrants, like the New Sanctuary Coalition. This particular coalition was created by immigrants for immigrants, and they provide these community-driven campaigns, paralegals. They have these pro se clinics. They educate immigrants and teach them about their rights. And overall, they offer kind of like a community for the immigrants. Unfortunately, the new administration has been pushing towards ending protection status for refugees, asylum seekers, and denying asylum hearings. Fortunately, these cases are going to court, but we don't know what's going to happen in the next few months. If you want to learn a little bit more about this and want to stay kind of like up to date with the news, this is a nice website. It's the highest website, and they have this kind of like one paragraph summaries of the latest news on the topic. So in summary, we are privileged. The world is complicated and full of injustices. There are desperate people all over the world willing to risk their lives for some hope. We have resources available even close to our hospital, but at the same time, they are dismantling some of the resources in several places. So we gotta kind of like continue watching the news and see how can we continue helping. Just a quick thing, I presented this picture before. And this is them in her kindergarten graduation, which I thought it was really cute. So that's it. It's my last presentation. I'm gonna say I'm very lucky to be here. I have grown so much. This is my first time living far from home. I survived, thank God. So far. I want to thank to like all my attendings in both sides of the street. They have challenged me daily. They have helped me become a better doctor, a person, and they helped me achieve stuff that I didn't even know I was capable. So thank you to all of my attendings. I want to especially thank my family for being my biggest supporters. I always say my mom, ever since I was a kid, she always said, you know, just do whatever you want and whatever makes you happy. If you want to go far away, go to China, study, whatever you want to do, I will support you. And I'm very grateful about that. Without their sacrifices, I definitely wouldn't be here at all. Even though I didn't have my parents and my siblings close by, I did have a new family, which is my class. And I'm definitely going to miss you all. There's some stuff that I'm not going to miss for sure. Having said that, I'm going to miss all of you and thank you guys for being my friends and family for the past 4 years.